Good evening, everyone. My name is Monita Sundar. I am the program coordinator for the Prostate Cancer Supportive Care Program. This evening's session is on recognition and management of treatment-related side effects of androgen deprivation therapy. Tonight's session is going to be delivered by Nikita Ivanov, who is a nurse practitioner from the BC Cancer Agency, and he will be presenting tonight's session. So on behalf of the physicians and the staff of the Vancouver Prostate Centre and the BC Cancer Agency, I welcome you tonight. Support for this initiative has been provided from a number of different organizations. I would like to specifically acknowledge the Special Services Committee, the BC Ministry of Health, and Prostate Cancer Foundation of BC, who have actually helped us and provided funding since the inception of our program in 2013. We're also very grateful for the philanthropic donations made by individuals to the PCSC program. So tonight's session is on recognition and management of treatment-related side effects of androgen deprivation therapy. But before we delve into that session, I'm just going to briefly go over the 5 other modules that are comprised of our program. The first module is called Introduction to Prostate Cancer and Primary Treatment Options. This is a bi-weekly education session for newly diagnosed prostate cancer patients and their partners and family members. This presentation is jointly presented by a urologist and radiation oncologist, and they've reviewed the anatomy of the prostate, treatment options, and side effects of prostate cancer. You also have an opportunity to speak with both the urologist and the radiation oncologist for about 5 to 7 minutes about any concerns you may have with your prostate cancer. There is also a patient representative present to answer any questions from attendees, and he will also be talking about his experience and his journey of prostate cancer. The second module is called Managing the Impact of Prostate Cancer Treatments on Sexual Function and Intimacy. This is a preemptive education session about sexual side effects of treatments and options for dealing with them, including options beyond standard erectile dysfunction treatments. The session is given monthly, both for patients and partners. Patients also have access to our sexual rehabilitation clinic with its staff of urologists, endocrinologists, a sexual medicine physician, plus an RN for sexual health. We also offer an intimacy workshop for couples every 3 months. Our third module is our lifestyle management module. This is comprised of 2 different specialties. Our first is focused on nutrition advice for prostate cancer patients. This is an education session that's delivered by a BC Cancer registered dietitian, and it's given every 3 months. Our second education session focuses on physical activity for prostate cancer patients, and this session is delivered by an exercise specialist. Participants can also be enrolled in exercise programs through the PCSC program. So part of our physical activity module, we also offer an opportunity for patients to meet with an exercise physiologist who will develop an exercise prescription. She will meet with you one-on-one 4 times throughout the year and devise an exercise prescription for you to be able to do out in the community or at home. Our 5th module is called Pelvic Floor Physiotherapy for Urinary Incontinence. This is another preemptive education session which runs in parallel with our sexual side effects management program, and it's also offered in advance of primary prostate cancer treatment. Marcy Diane is one of our few physiotherapists in Canada with a certified specialty in pelvic floor rehabilitation. This is both a prehabilitative and rehabilitative training for patients. Part of our pelvic floor module, we also offer one-on-one physiotherapy sessions using biofeedback training for pre-surgical patients or for patients experiencing urinary incontinence post-surgery. Our 6th module is Counseling Services and Group Therapy Workshop. We offer counseling sessions for patients who are having difficulty coping with their prostate cancer diagnosis, if they're feeling anxious or sadness. There is services available to see our clinical counselor, and this is also offered to patients' partners or spouses, and you have up to 6 sessions available per patient and partner. What we also offer is a group workshop called Living with Prostate Cancer. This is a group workshop for men to adjust living with their diagnosis. Each group workshop is held once a week for 3 consecutive weeks. So with that said, I'd like now to introduce Nikita Ivanov, who's going to be delivering the rest of the session on hormone therapy.
Hello everyone, and thank you for coming to today's session. As Monita mentioned, my name is Nikita and I work as a nurse practitioner, as a member of a multidisciplinary genitourinary tumor group at BC Cancer Agency. Majority of my patients in the practice are patients with metastatic prostate cancer, and those patients been on androgen deprivation therapy for a long period of time. And unfortunately, about 80% of my patients suffer from the side effects of androgen deprivation therapy, which interfere with their quality of life, lead to other comorbidities, and also exacerbate their chronic conditions. So in today's sessions, I'm going to talk about why we use androgen deprivation therapy in prostate cancer, how does androgen deprivation therapy work, what are the side effects of androgen deprivation therapy, and how can we prevent or improve the quality of life of patients who are on androgen deprivation therapy. So majority of the patients who come in my clinic already had primary therapy, and there are several approaches to primary therapy. One approach is surgery, which is known as total radical prostatectomy. Another approach is a radiation treatment, either external beam radiation treatment or implantation of radioactive seeds directly into the prostate gland, also known as brachytherapy. And you can attend this session, module 1, which will talk about the primary therapy approach to the prostate cancer. So unfortunately, patients who undergone primary therapy also experience some side effects from primary therapy, and majority of those side effects are the urinary side effects and effects which interfere with erectile function, which also can lead to decline on overall quality of life and stresses with partners and psychological distress. Unfortunately, androgen deprivation therapy, besides having its own set of the side effects, which we're going to discuss later, can exacerbate the existing side effects from the primary therapy. So why do we even talk about the androgen deprivation therapy, and what is androgen? Androgen is a male hormone, more commonly known as testosterone, and produced by males throughout their lifespan. And it's initially produced once the male hit puberty, and the levels slowly decline as man ages. It's important for many functions in the body. It's also important for maintenance health of the prostate gland. Unfortunately, it's also the hormone which drives the progression of the prostate cancer. And this was discovered by Dr. Charles Huggins back in 1950, when he found out that surgical removal of testes reduces pain in patients with metastatic prostate cancer, improves their quality of life, and helps them live longer. Till about 1980, it was the main approach to treatment of patients with prostate cancer. So around 1980s, other approaches to control testosterone were developed, and those approaches were in form of injections. The main point here is now patients have different choices on how to lower the testosterone level and how to control the progression of their prostate cancer. And this is the question to discuss with either medical oncologist or urologist or immediate healthcare provider. So as patients come to my clinic, they ask me if androgen deprivation therapy is so good in controlling prostate cancer, why I'm not cured? So you can think essentially of testosterone as the food for the prostate cancer, and majority of cells die once the patient undergo androgen deprivation therapy, but unfortunately some of the cells become dormant, and give time, those cells learn how and adapt to the low levels of testosterone in the patient's bloodstream, or actually learn how to produce testosterone inside the cells, which leads to the cancer progression. So now we're going to talk about options on how to control testosterone. As the first option as described, it's not on the slide, is the surgical castration, and might be a good option for the patients who have really aggressive disease, who don't like injections, or for some reasons if the injections are not covered. Another option is the human luteinizing hormone-releasing hormone agonist. If you think on how to make testosterone in male body, you need three things. One, you need someone to tell testes to produce testosterone. You need a monitor, actually, which monitors the level of testosterone in a person's blood, and you need an actual factory which produces testosterone. So the role of the monitor is taken by hypothalamus, which monitors the level of testosterone in patient's blood. If it finds or registered that the level of testosterone are low, it stimulates pituitary, which is a stimulator, to tell testes which are producer, to produce testosterone. So the way the luteinizing hormone-releasing hormone agonists act, it mimics the signal from hypothalamus to pituitary, telling pituitary that the levels of testosterone is low. So it overstimulates pituitary gland, which leads to overexhaustion of pituitary gland and desensitization of the receptors both on the pituitary gland and on testes. And over time, it leads to shutdown of the whole excess production of the testosterone. So what is the advantage of this therapy? This therapy can be taken every 3 months. There are a variety of the options available in the form of goserelin injections and leuprolide injections. Can be subcutaneous or intramuscular. The downside of this option is that there is initial surge of testosterone, which in some patients with metastatic disease can lead to rapid progression of cancer and the side effects from the cancer progression. Another downside that some of the size of the needle, for example, for the goserelin is quite large, and patients can be uncomfortable for the injection itself. So as I mentioned, there is another downside of this injection is the surge, and then patients need to take an additional medication on top of the injection for the period of 1 month. And those medications are non-steroidal anti-androgens, and it can be either of bicalutamide, nilotinamide, or apalutamide. Again, usually the choice of medication is based on the preference of the treating physician. So another downside of those previous injections is that it takes about 21 days, or roughly 3 weeks, to testosterone to be lowered to undetectable levels. So the next options for patients with the prostate cancer is luteinizing hormone-releasing hormone antagonist. So what this medication does, it directly blocks the ability of pituitary to be stimulated by hypothalamus. So it shutdowns the production of luteinizing hormone. Basically, it shutdowns the signal to the testes to produce testosterone. So the action is almost immediate. The testosterone load rather quickly. So this is a good option for the patients who have extensive metastatic disease. So the downside of this option is that initially patients have to take 2 injections. They can experience a local reaction to the injections, and the injection has to be given on a monthly basis. Also, overall, pharmacological companies were good in providing home injections program previously for patients on androgen deprivation therapy, and unfortunately, a company which makes degarelix stopped providing home injection program, which can be a downside for the patients who are elderly and who can't make an appointment on a monthly basis to their physicians. So when we talk about the testosterone as a hormone, it is responsible for many functions in person's body. So the patients, when they ask me, can I switch from one injection to another and maybe my side effects will go away? And unfortunately, majority of the side effects that patients actually experience is not due to the injection itself, but rather than the low levels of the testosterone. So testosterone is responsible for maintaining skin health, muscle growth, maintaining libido, maintaining erectile function, bone strength, and responsible for other functions in the body. So when the physician tell you that the patient is going to go on the androgen deprivation therapy, we usually tell patients that they will lose their libido, they will have issues with their erectile function, and that they will experience hot flashes. So unfortunately, majority of the patients on androgen deprivation therapy will lose their sex drive. There is no magic pill to improve sex drive. It is age related. What it means, so with age, level of testosterone in males get lower, so there is less libido in the elderly man compared to the younger man. So the older the man gets, the less effect on libido they will notice on the androgen deprivation therapy. At the same time, if the person is younger and if they are on intermittent androgen deprivation therapy, they will recover much quicker when the androgen deprivation therapy is stopped compared to the patient who is actually of age. So what can we do about helping patients who have low sex drive? Again, as Monita previously mentioned, we have a good program on sexual health and education. Exercise will boost libido, and we do suggest for the patients to focus on intimacy. Another side effect is erectile dysfunction. Unfortunately, majority of patients on androgen deprivation therapy will experience some issues with erectile function, even if they previously had no issues with erectile function before the start of the androgen deprivation therapy. Good thing that the orgasm is still possible even with erectile dysfunction. And again, I would suggest for the patients to attend the module on sexual health and education. One of the most commonly mentioned side effects is hot flashes. So for some patients it's trivial, for other patients it's one of the worst side effects. It commonly occurs within the first 2 months of starting androgen deprivation therapy. Again, in my practice I have patients who don't experience any hot flashes or they don't particularly care about the side effects of the hot flashes. At the same time, I have patients who are ashamed to show in public because they sweat so much. They miss their daughter's weddings. Some patients describe the intensity of hot flashes, that it's affect sometimes patients say that hot flashes affect them physically to the point that their knee buckle. So what are some factors which can exacerbate or aggravate hot flashes? Usually alcohol, spicy food, caffeine can intensify hot flashes, as well as heat and stress. What we suggest to the patient: follow a regular exercise program, wear appropriate clothing, wear the layers. There are some medications which have been shown to be helpful to reduce the intensity of hot flashes. There is no medications which completely gets rid of hot flashes, and such medications like gabapentin and Effexor have been clinically proven to reduce the intensity of hot flashes, and this is something you can talk to your healthcare provider about. So So what do you usually see when you start on the androgen deprivation therapy? After a while, patients notice weight gain, gynecomastia increase in breast tissue, loss of muscle mass and strength, decrease of size of penis and testes, and some hair changes. And we go in more detail about those side effects. So unfortunately, in our practice, majority of men who come to our clinic already have issues with their weight. And on average, a person is expected to gain 5 to 10 kilograms over the period of 6 to 9 months. Majority of this fat is accumulates in waist, hip or thighs. On top of the gaining fat mass, people lose muscle mass and strength. And the other point is that the weight which is gained during the androgen deprivation therapy is hard to lose. So what is our recommendation? The patients need to be physically active, aerobic exercise and resistant exercise, engage in healthy dietary habits, and as Monita mentioned before, we have a lifestyle management module where you can meet the nutritionist and a physiotherapist to discuss appropriate measures to maintain diet and the level exercise needed particularly for you. Another side effects of the shrinkage of penis and testes. Genital shrinkage is common. Not a lot of patients who say that it's a severe side effect for them, but patients do notice especially the reduction of size of testes and about a maximum 1 inch in penile length. This is caused by apoptosis of trabecular smooth muscle, impaired veno-occlusive mechanism, and some of the fibrotic changes. So usually the side effects stop within 12 to 18 months of androgen deprivation therapy. Again, there is no magical pill to stop the side effects, and I suggest to consult with a sexual health worker and attend a module on sexual health education. Hair changes, it's not going to be drastic as you can see here in the pictures, but patients generally see and notice the thinning of the hair, particularly on their body, not as much on the head. They can find that the beard or mustache are softer. For some people it might be a bothersome side effect. So for the majority of the patients, they don't recognize it necessarily as a side effect. The main point here, it's reversible if the androgen deprivation therapy is stopped. What are some side effects that you actually don't see? The loss of bone density, anemia, reduction in hemoglobin of red blood cells, and metabolic syndrome, which is a group of medical conditions such as hyperlipidemia, increased in lipids, hypertension, increased in blood pressure, and diabetes, increased in blood sugars. Loss of bone density. So many men already have low bone mineral density before they start androgen deprivation therapy. And unfortunately, patients who are on androgen deprivation therapy lose bone mass 5 times faster than on patients not on androgen deprivation therapy. And this puts them at risk for fractures. They're twice as likely to have a fracture as the men who are not on androgen deprivation therapy. This further exacerbated by loss of muscle mass and strength, and loss of bone mass density usually continues over time. For the patients who start on androgen deprivation therapy, we generally recommend to have a bone density scan to assess their risk of fracture. For all the patients, we recommend 500 milligrams of calcium and 400 to 800 international units of vitamin D daily. For men who have risk fracture more than 20% over the period of 10 years, we suggest to use another medication to improve their bone density. one of those medications and denosumab, and again, you can discuss initiation of this medication with your healthcare provider. What you can do to support or build up your bone mass density is actually to have a resistance exercise and high impact exercises. Metabolic syndrome, as we talked previously, patients on androgen deprivation therapy gain about 5 to 10 kilograms in weight. This leads to increased blood pressure, that leads to build up in cholesterol level, then leads to increase in insulin resistance and high risk of diabetes. It also leads to increase in cardiovascular effects. So it is important to maintain healthy nutrition and maintain exercise. I'll continue to mention, please attend or think about attending Module 3 on lifestyle modifications for the patients with prostate cancer. There is some medication approach to treat hypertension, hyperlipidemia, but generally our preference is for the patients to maintain healthy lifestyle. So what do you usually feel on the androgen deprivation therapy? Fatigue, depression, emotional issues, and cognitive issues. Fatigue, this is one of the worst side effects of the androgen deprivation therapy. Almost every single person feels a certain level of fatigue while they're on therapy. Again, there is no magic pill to boost patients' energy. However, the studies show that patients who exercise 3 hours per week, do vigorous activity, actually feel better and live longer compared to the patients who don't. And what I mean by vigorous activity, this is generally not the stroll in the park, but a quite intensive exercise where the person who exercises becomes short of breath and his exercise is borderline uncomfortable. And it includes 150 minutes per week of moderate to vigorous physical activity in addition to 2 to 3 resistance training sessions. And again, this can be discussed with a physiotherapist, and the exercise plan could be established specifically for you and for your needs. Depression, it's important to acknowledge that patients on androgen deprivation therapy and patients who've been diagnosed with prostate cancer experience 8 times higher level of depression than the patients in general population. So risk of the depression in fact increases with the duration of androgen deprivation therapy. Also, patients who have pre-existing depression are more likely to develop depression. Again, there is some medication which can help patients with the symptoms of the depression, but I will suggest to contact the counselor or contact a Monita and attend a counseling session if you're experiencing issues with your mood or you're concerned about symptoms of depression. Cognitive function. Androgen deprivation therapy doesn't directly affect cognitive functions in patients. However, it does impact on spatial memory, meaning that patients sometimes tend to be forgetful in terms of where they left their car, they left their keys. What can be done about this? It's computerized cognitive training, learning another language, reading, reduce alcohol consumption, and reduce consumption of other antidepressants or other depressants. And of course, exercise will boost not only cognition but overall well-being in patients. The take-home message is androgen deprivation therapy has a lot of side effects, and not necessarily you will experience all side effects of androgen deprivation therapy. Only up to about 20% of men are lucky enough not to experience any side effects from androgen deprivation therapy. Dealing with side effects proactively is the best way to avoid long-term issues on the androgen deprivation therapy. Exercise and physical activity are the most effective treatments for the majority of the side effects of androgen deprivation therapy. Saying this, generally the patients have to be an active participant in prevention strategies, and we're here to help and to answer your questions. So if you have any further questions, please ask. Again, thank you everyone participating in today's sessions. We have wonderful questions today. If you're interested in any of the modules we discussed here today, please contact Monita. You're always welcome to ask questions. You can email Monita with questions and she will contact me. Thank you very much again for participating.